expect as a webinar attendee today. You have a few controls that you should see at the bottom of your screen. These will be the go-to ways to participate in discussion for today. There's a chat option. Just be sure to select whether you want to send a chat to just the panelists. Those are the folks you see on the screen, or to the panelists as well as everyone else that is in the virtual room today. You can also use the Q&A function. That's a great way to submit questions throughout. That way you can let us know your thoughts as we go along, and we can see that in real time. And then if there is time and opportunity for unmuting folks, there is the raise hand option, and our moderators will let you know if we have opportunity for that today, if there's time to unmute you. Anything else you'd like me to cover, Faye? That's the basics.
No.
All
Let
right.
me turn on our webinar.
And I will kick it over to whoever is going to screen share from here.
Okay. All right. Good afternoon, everyone. I'm Faye Taxman, and I'm joined today by a number of my colleagues that are participating in this particular study. I am Justice Behavioral Health. I'm going to put up the slides now, and then I'll introduce the team and also introduce some of our partners. All right. Can everyone see that?
Yes.
Okay, thank you. Well, thank you very much for joining our webinar today. We're going to be talking about strategies to improve or to reduce jail populations by improving mental health services. This is part of a National Institute on Mental Health study, and it's the first in a series of webinars. Our webinar today is going to be an introduction to the study, as well as an introduction to some of our preliminary findings, as well as to give you a peek of what we're actually doing as part of this study. So we have an extensive team of people who are involved. This is the 5 of us on the screen are just a handful. We also have Ben Mackey, we have Terry Wilson, we have Morgan Moffitt, we have Tanisha Thurman, we have Nick Paul. I mean, I could go through a list, but we have an extensive team. And again, we're funded by the National Institute on Mental Health. Now, the purpose of our webinar today is to go through this big picture of what we're learning in this particular study and hopefully give you some guidance as thinking about how you might be able to use it within your own jurisdiction. I also want to indicate that today we're fortunate to have our partners participate. The Council of State Government Justice Center, NACO, and the American Psychiatric Association Foundation. Katie or Kia, I know you guys are here. Would you like to say something?
Sure, thanks, Faye. I'll jump in. Hi, everyone. My name's Katie Herbert with the Council of State Governments Justice Center, and I work on Stepping Up, and I'm very thrilled to be partnering with the team that you just met on this project. I would just love to encourage everyone as you're listening to the webinar today to, if you haven't already, to participate in the study and the survey. I think it's both beneficial to your jurisdiction and your county, and also the field at large, which you'll hear about today. So even if you're not part of Stepping Up, we would love to have you participate and be a part of this. So thanks in advance for considering that. And Faye, thanks for having me.
No, thanks for coming, Katie. Kia, would you like to say something?
Absolutely. Well said, Katie. My name is Kia Pollard. I am with the National Association of Counties and also in partnership with this great team of leaders from all of these organizations. And we are excited to have you participate in this webinar. And to add to what Katie said, all of your participation is critical to our next steps and direction for the initiative, and making it as fruitful for you and your jurisdictions as we can. So we appreciate your participation and hope you enjoy what you hear and learn something today. Thanks, Faye.
Thank you. Thank you very much. All right, so let's get started. So I first want, sorry, a little sensitive mouse here. I first want to basically talk about the study. So the study is essentially looking at 910 counties in the United States. Half of the counties are participating in Stepping Up, which Katie had mentioned, and half are not. And we're really trying to learn about what factors impact the size of a jail population and what factors impact the number of treatment services available, particularly for mental health in a community. So, we're going to start off our presentation today to basically tell you something I know everyone knows, which is the size of the population of a county matters. And it matters in a lot of different ways. We know that counties that have over 250,000 population or more are more likely to have resources. In this case, this is the mean per capita clinics in a county. So in a large county that's 750,000 or more, there's approximately 4.7 clinics per 1,000. In a medium-sized county, 4.15, and in a small county, 2.97. So this isn't nothing new in terms of, we know there's resource distribution issues. But the question is, how does this matter? And this is part of what we want to learn in this study, is what factors affect jail populations. So let's also move on to the provider rates here. So we also know that medium to large counties have more mental health providers. That includes psychologists, counselors, social workers, psychiatrists, and the cadre of people that are available to help people that suffer with mental health disorders. We also know that since size matters here, that there are other factors that affect this distribution of how many providers there are. And that's kind of a sneak preview that my colleague Niloofar will talk about as we move into this webinar. And then finally, a little bit surprising, at least I was surprised, we learned that smaller counties tend to have more people incarcerated in their local jails than larger and medium-sized counties. And this was an interesting factor that we didn't really anticipate as much. And as Niloofar will discuss further as we go through this presentation, we're going to learn some of those factors besides county that affect the size of the jail population. So jails, as we know, are in the community. We also know that jails have a higher proportion of people with mental health and substance use disorders. We know that people who are incarcerated in jail pre-trial are more likely to go to prison. So what happens in pre-trial affects whether or not someone's likely to get a prison sentence. And we also know that people with mental illness, that increases the length of stay in jails. So these are important facts, but they are also facts that give us incentive to begin to think about how else can we affect who's in the jail and how do we affect how we can deliver services outside the jail to better serve people with mental illness that commit crimes. So the question that we want to ask in our study is, what strategies can counties use to alter who's in jail and how long the person stays in jail? Now, this is actually one of the goals of the Stepping Up initiative, is to look at who's in jail and the length of stay in jail. But we want to expand this to really think about this in terms of all counties in the United States. And in case you didn't know, there's about 3,200 counties in the United States. So we have a need to really understand how justice and mental health systems interact together and what impact that actually has in terms of what types of services are available in a particular county. We want to garner more information about how to reach more individuals with evidence-based treatments and practices, because we know that those treatments and practices are really designed to produce better client-level outcomes. Obviously, they produce better system outcomes. And we also want to know how to keep individuals with mental illness out of jail and in a safe place that they can actually get care for their needs. So the I Am Justice Behavioral Health Study, which again, I've indicated involves both the stepping up counties and non-stepping up counties, is to basically allow us to learn about what steps individual counties take to better serve individuals with mental health issues, whether they're in the jail or in the community. We have three main goals. One is to identify and learn from practices that you all use. Another goal is to assess the impact of these practices on the availability of evidence-based treatments and practices, then assess how implementation strategies can be used to increase the revenue, the resources available to offer evidence-based treatment and practices, both in the justice system and in the mental health system, and then help us really draw generalizable lessons about how to do policy reform and implementation. We know that all of these things depend upon the size of a jurisdiction. They depend upon the climate, the organizational climate of a jurisdiction, and the resources available. And so our study is really trying to look at these factors. That's why I started off this presentation talking about whether size matters, and preliminary evidence and logic tells us that size does matter of the population in a jurisdiction because it's correlated with resources available. Our study is really designed around this question about implementation. We want to know, how does it work? We want to know what mechanisms, and mechanisms is a scientific terminology that's basically used to tell us the story of, if you do certain things, what kind of effect will you get? So we've identified 4 mechanisms that we're interested in learning about. We're interested in learning about performance metrics that jurisdictions may use. We're interested in learning about interagency teams. We're interested in learning about common goals across agencies, and then how systems and programs and services are integrated. And this is all designed to help us answer the question, how does it work? That's the first question. The second question is if you change any of these mechanisms, what will be the impact? Will you increase resources available to your jurisdiction? Will you expand the types of services that are available in the community? Or will you actually be able to implement more evidence-based practices and services? So these are the large research questions that we have as part of our particular study. So the study itself, as Katie indicated, we have an online survey, and we're actually trying to survey 4 people from each jurisdiction, each of these 950 jurisdictions, a behavioral health administrator, a jail administrator, probation chief or probation administrator, and a substance abuse administrator, because we want to learn from the different lenses of the actors involved in counties in terms of what happens in terms of planning strategies and implementation impact, and what that actually does to resources available. We're currently in the baseline period of time where we're collecting surveys. So far, we have surveys from about 397 of our 950 jurisdictions, and we plan in about 18 months, maybe a little bit longer, because COVID, of course, has affected everyone, to go back out and learn more. That will be a shorter survey than our baseline survey. And then we plan to go out in another 36 months. In addition, my dear colleague Jennifer Johnson is going to be conducting interviews with 60 people each year across these jurisdictions, randomly selected. So we really would appreciate your help and participation in this study. This webinar is to basically tell you about the study, but also tell you what we're learning thus far. But the thing we really want to do, and you'll see a little snippet of it today, is to provide you with a feedback report that tells you what's going on in your county. And this would be a collection from the different surveys that we get from different people within your particular county. And I'm going to show you an example. One of our researchers, Tanisha Thurman, has been very active in generating this feedback report. And we have a team of counties, about 6, that have been helpful in helping us think about what type of feedback report would be useful for the county. Okay, so that's the background of the study. If you have questions, please indicate, as Alex and Cameron have indicated, a Q&A or chat. Alex, are there any chat questions before I go on?
Yes, somebody has asked, how do we find out if our county is participating?
There will be an email address at the end that you can contact for that. Alex, perhaps you could put that email address in the chat box for me.
Yes.
Okay. Any other questions?
Somebody else asked, how do we define clinic for the purposes of the study?
So we use the HRSA definition of a clinic in terms of the information that we got. And so a clinic was basically designed as a physical facility that offers mental health services. And we're going to have a webinar in July that will go through the data resources that we've used so that we can help you learn about some of these national sources that are very useful at the county level to learn about your own county. Other questions, Alex?
Yeah, another question says, how are the selections of counties that are a part of the 50% that are not currently stepping up counties selected for survey participation?
Oh, what a great question. Thank you, whoever sent out that question. So we actually did an analysis, and you're going to see that analysis, some of that analysis today, to look at the factors that are related to the size of the jail population per capita, again, taking into account the size of a jurisdiction, and the factors that are related to how many mental health providers are available in your county. And so Niloofar is going to go through the various models that we created. We sort of have a very generic sense of the model, so we're not going to bore you with all the machine learning and statistical procedures that she's an expert at. But we then created an index score in terms of the social demographic characteristics of a county based upon mental health services available, based upon size of the jurisdiction, based upon social indicators of mental health and substance use disorders. All of the different sources, as I said, will be discussed at a webinar next month. And we use that index to do what's called a case controlled match. So if we have a stepping up county, we found another county that looked like that county in terms of the size of the jurisdiction, in terms of the characteristics, demographics, issues related to prevalence of substance use disorder. All right, so more on that as we proceed. Alex, any one last burning question before I move on?
Yes, one last question is, do each of the 4 responders receive the same survey?
Yes, and that's been a bit of a complicating factor. Each respondent will receive the 4 surveys. We have some jurisdictions that asked us to send one survey and then they can fill in different parts. And we have what's called a fillable survey. So when our researchers contact you, or if you contact us, we are more than happy to give you a fillable survey so that we can get these different perspectives in one instrument, or we send 4 different surveys. All right. Okay, so I'm going to continue, but these are wonderful questions and keep them coming. And Alex, I'll in each segment, I'll stop and ask for you to give questions. So Pam Lattimore, who's from Research Triangle Institute, as part of a study that she's doing on pretrial practices, basically did a survey that was published in 2020, looking at the prevalence of different availability of services at the pretrial level. And she essentially, and I've got a summary here of this particular article. I also gave you a reference in case you want to look this up. This is an online journal, Federal Probation, so you should be able to get access to it. But she basically learned that about 1/3 of the counties had a jail diversion to treatment program. About 50%, a little bit over 50%, had an intake unit within their jail that assessed people for mental health and or substance use. And about 63% of the reporting counties had crisis intervention teams. So our study is basically to extend this type of information to get a better sense of what's available in the counties and why are certain things selected, so that we can help our partners, NACO, CSG, and the American Psychiatric Association Foundation really think about how to help counties better provide for people with mental illness. So, this particular survey lays a foundation, but it's very limited because it's primarily focused on pretrial. So as part of our survey, I'm going to show you some preliminary information. This is very preliminary. So this is the results of our first 397 counties that responded thus far to our surveys. And you can see here, I'm just going to go through the first 3. There's a list here, and I'm happy to provide slides to anyone who would like this. But we essentially learned out of almost 400 counties that about 1/3, a little bit more than 1/3, have a way to divert people from the criminal justice system to mental health treatment services. About half have some type of problem-solving court. This is not just a mental health court. It could be a drug treatment court. It could be a veterans court. And then about less than 20% have some sort of drop-in center, walk-in center, crisis place for police to drop off individuals that are experiencing some sort of mental health crisis. So this is what I'm talking about in terms of laying a foundation for you in terms of a feedback report. This is an example of one of our planned feedback reports, which we would basically share with you what is your jurisdiction doing and what are other jurisdictions doing, so that you can actually use that as a way of thinking about your own efforts to either enhance mental health services in or out of the jail, or to think about other alternatives. Similarly, we are looking at what types of evidence-based treatments are available for your populations. Again, this is preliminary data from about 400 responding counties. Various participants gave us this particular information, but this basically lets us look at, again, is your jurisdiction providing first or second generation medications? Are they providing what types of cognitive behavioral or other behavioral interventions? And what's actually available in your jurisdiction. So this will also be on the feedback reports. And they allow you to assess, is this how you want to basically provide services within your jurisdiction? So let's take bipolar as an example. So we learned through this first cohort that about 36% of the counties offer some sort of mood stabilizers. About 30% provide education on bipolar disorder as part of a treatment. And then around 17% offer family education about bipolar disorder. So this is an area in which you could actually think about, is this, given the nature of the clients that you have in your jurisdiction, is this the right mix of services? What else should we be offering given the types of mental health issues that clients have? So again, this is another part of our feedback report. One part of our feedback report will also be on what type of change practices do your county use in order to affect the size of the jail population or the availability of services in the community. So we looked at the research literature, identified those types of change practices that are important to make alter how we actually make changes in policy and practice. And we've now asked you to provide us information about which of these practices do you use. So I'm not going to go through this full list. I can send you, anyone who's interested, a reference list about these particular practices. But our driving question here is, if you use these different practices, what impact would that have on the types of services that are available within your county and on the size of your jail population? And this becomes really critical because, there's hardly any studies that tell us how to really have a large impact in terms of, at the county level, in terms of criminal justice and mental health policy. And that's the novelty of this study overall. Now, we know there are, in the substance abuse field, we know there's something called NIATEX, which combines a policy team and also combines performance metrics as a way of really trying to, make changes. But what we don't know is how many counties use that type of strategy. What impact does the quality improvement process have on resources available or metrics for your particular jurisdiction? So this is one of the critical pieces of this study, and it's really critical for our partner agencies because then they could use this data to begin to think about what kind of technical assistance would be useful to really expand and to have an impact on counties and county practices. So Alex, before I turn this presentation over to Niloofar, are there other driving questions?
Not right now. There are two questions that were asked in the Q&A, but Jennifer had answered them. The first one being, does this survey target juveniles and adults? But it is specifically for adults. And then someone else asked, when is the survey due? To which Jennifer replied, around August 1st or so would be ideal, but we will take the survey whenever you can get it to us, but just let us know.
Okay, thank you. All right, so I am now going to turn this presentation over to Niloofar Ramezani. She is a statistician at George Mason University and a rising star in terms of the field overall about statistical analysis for mental health services. So Niloofar?
Thank you. So I want to welcome all of you to this webinar, and I am going to talk about a few of the results that we've seen so far about what factors are affecting the jail population and mental health provider rates that are the key factors in mental health and jail reform initiatives at the county level. It's important to look at these factors at the county level because there are a lot of studies done at like the state level, and fewer studies done at the county level. So we're going to address that during this webinar and the next webinar. So what data sources were used to examine factors related to these two factors? These are publicly available, and we will talk more about them during the next webinar. That, how can you access them? How can you use them and take the needed variables out of them to benefit your own counties? So we use the raw count of county pretrial and jail populations from Vera Institute's incarceration trends database. We took county health, economic, social, and demographic data from the county health rankings and roadmaps. In addition to that, we took police and crime data from the uniform crime reports. And finally, we took county population data from United States Census Bureau. So what were the most important variables? Because of course, as you can imagine, there were so many variables out there that we could have extracted, used them. And what did we do? We used the expert opinion, of course, plus some statistical and machine learning techniques in order to find the important variables that might be correlated with, the jail capacity, as well as the mental health infrastructure in the counties. That we have summarized them right here for you in three main categories. So the first one, healthcare. So what are these variables that we looked at? Of course, we looked at way more variables, but these are the most important variables related to these outcomes. Number of physically unhealthy days reported by the residents of the counties in a month that actually tells us how healthy or unhealthy the residents of the counties think they are. Primary care physician rates in order to look at the more physical health of the residents, as well as the healthcare costs and expenditures, the total healthcare costs. In addition to that, we looked at, for example, the percent of the drug treatment that was paid by Medicaid. And we looked at some mental health provider variables, such as psychiatrists per capita and psychologists per capita, and of course, community mental health centers. And finally, whether there existed any medical schools in the counties. We looked at that variable as well. There were some crime-related variables that we looked at, such as violent crime rate, that we look, as well as the police per capita, which actually it's looking at the concentration of the number of police in a jurisdiction area. We looked at homicide rate, we looked at firearm fatality rate. Some of the demographic variables that were important included the high school graduation rate that was actually representing the education level of the
So I think that Niloofar froze.
Percent of the population that are Black and percent of the population that are Hispanic. Also, we actually looked at the county size, that we categorized them into three main categories, as Dr. Taxman mentioned: small, medium, and large counties. And finally, we looked at the percent of rural areas in the counties. So here are some interesting results for you, which I'm not going to go into the details of the models fitted, but we were trying to predict what are the county level factors that are actually influencing the jail size, the jail population, incarceration rate. So what are they? We have actually categorized them into three main categories for you. Significant healthcare related variables, significant demographic variables, as well as significant criminal justice variables. So the purple arrows that you see right here, they are related to an increase in the jail population per capita, and the blue arrows are related to a decrease in jail population per capita. So what does it mean? It means that, for example, the higher the number of physically unhealthy days the residents of the counties were, the higher the healthcare cost expenditures were. it resulted in a lower incarceration rate in those counties. On the other hand, the lower the percent of drug treatment paid by Medicaid and psychiatrists per capita was in a county, it actually resulted in smaller jail size. Among the criminal justice variables, the concentration of the number of police in an area was the only variable that was significant in the presence of all of these other variables that we are considering. So the higher the concentration of the police in those areas, the higher the jail population size was. Finally, the significant demographic variables included like the less educated, like the citizens of the counties were, or the smaller the size of the county was, we ended up seeing a smaller jail population size. So what are the insignificant variables that we're having there? Violent crime rate, income inequality, primary care physician rates, and finally community mental health centers per capita. They were not significant in the presence of all of these other variables. So the next variable that we looked at was we wanted to look at the mental health capacity of the counties and see what are the variables that are related to it or affecting this important factor in the counties. So, the higher the number of physically unhealthy days was, higher the primary care physician rate per capita, and the higher the percent of drug treatment paid by Medicaid, the higher, the mental health infrastructure was in the county. The lower the education level, the lower and the lower the percent of Black and Hispanic population were, the higher we saw that we had the mental health providers right in the county. The higher the income inequality and violent crime rate were in a county,
So I'm going to ask the other panelists.
the concentration of,
Niloofar, can you repeat, because you froze for a second. So can you repeat the police and violent crime?
absolutely. Absolutely. I'm sorry if my internet is unstable. I apologize. Sure. So the lower the concentration of the police in a jurisdiction was, and the higher the violent crime rate was, we noticed that we actually had an increase in the capacity of mental health resources in those counties. So what did we learn? We showed you all these results and statistical results. So what does that mean? Well, healthcare infrastructure, for example, the percent of drug treatment paid by Medicaid or per capita psychiatrists, they affected the size of the jail population. And therefore, attention to improving county level community health services, their availability and accessibility will go a long way for your counties to reduce the use of jail for mentally ill population. However, the criminal justice factors, such as concentration of police services in the jurisdiction, are not as important as the public health factors that we discussed in actually influencing the size of the jail population in the counties. For instance, violent crime rate did not really predict the per capita jail population, size significantly. So what else did we learn? So the next thing that we actually learned was about the service deserts. There are not as many mental health providers as needed based on the population of the counties that are in need of these mental health services. So availability of mental health services in the community affects the per capita jail population size. And therefore, more community programming provides options to reduce the use of jails for the mentally ill. So other services, other centers are needed to help this population. some implementation strategies are more important than others, but which ones? And that is what we are discussing. That is what we're studying. And that is what we are going to share with you all in the next few slides and in future webinars. So what you can do with these results? Well, mapping your system on the variables used in the study that are also summarized, some of the most important ones in this table right here. You can actually use these variables to study and see where your county stands for each of these, these variables, these factors that are important for, predicting the size of the jail population as well as capacity of mental health resources in your county. Examining the facilitators or barriers in your county. This is another thing that by addressing them, it can help these mentally ill population that are in need of help. Considering different approaches based on the population of your county, as well as learning from other jurisdictions.
So Niloofar froze again, so I'm going to finish her thought, which is, so we provide these as measures and we're happy to send them to anyone. But we're thinking that because we found in the machine learning techniques that Niloofar and Alex did as part of our analysis, that these were important factors to look at in your jurisdiction, that they might be useful for you to look at to really understand what might be some of the drivers in terms of the size of your jail population, or in terms of, what your capacity is to provide treatment services in and out of jails. Our partner organizations of NACO, CSG, and APAF are available regardless of whether you're in a Stepping Up county or not. I encourage you to reach out. Hope that's fine, Kia. But we encourage you to reach out because they have a great resources about how to affect policy and practice at the county level. And as Niloofar indicated, most of the studies are at state level. And as an old-time criminal justice researcher, I've always been told it's really hard to do studies at the county level. So I wanted to rise to the challenge in this particular study. But, because as we know, everything's local. And so we need to really focus our attention at the local level. As we said, this is the beginning of a series of webinars. Our next one is July 14th, and we're going to go into more about these data sources for people in case you're interested, and also what are some of the factors that affected whether or not counties elect to participate in initiatives like Stepping Up or the MacArthur Foundation initiative. And so we're going to talk about data sources. Again, this might be useful for you at the county level to really understand, what data you could look at besides what's available in your county. These are nationally collected data. So that's one webinar. And then we will have a webinar in August to really dive into what's on our feedback report and how to use that information. And then we have planned in the fall other webinars to really help kind of share information that we're learning, but also hear from you all. And I highly recommend that you contact us if you have any questions. So here's the contact information. I am Justice Behavioral Health at ucf.edu. That is the location of our central web address. In order to get information about the study, also to learn about participation. Many of you have heard from many of our researchers who have been active in trying to send out notices about the study, but also encourage participation. If you elect to be part of the study, or if you're part of our sampling of 950 counties, Please complete the survey instrument and return it to us. As Jennifer said, we would love to have it by August 1st, but we're pretty flexible on dates because we know everyone has a lot on their plates. Also, if you could let us know who else in your county is active in some of your planning efforts. And then, as we indicated up front, if you, we are doing some interviews, and if you're asked to be interviews, please join us. Please tell us your stories. This is how we're going to learn more about what happens in local jurisdictions and translate that into information about, what mechanisms make a difference in changing policy and practice. And so that's basically our presentation this afternoon. Alex, I'm going to turn this over to you so that you could actually do the Q&A, and I'm going to go back so people, well, you have our address here. So I'm going to turn off the PowerPoint so we can see the Jeopardy squares, and let's have some questions and answers.
So I think Jennifer is going to kind of moderate this Q&A session, but I'll start reading out some of the questions that have been still kind of floating in the chat. So 2 questions were raised about how we measured the per capita mental health providers, psychology or psychiatrists and psychology per capita, and if those measures took into consideration telemed services. So those variables more reflect the actual presence of those practitioners in their field. So it's not so much about where they are giving their services, but where they're located at. And not to mention this data was collected pre-COVID. So we know that COVID kind of really kicked off this telemedicine world. And so all this information was kind of collected pre-COVID, and that would be a great measure for us to kind of update this on post-COVID. So that way we can kind of account for those telemedicine practices. Another question that was put into the chat was, I would think that jail population is highly dependent on bail practices, which in turn is very dependent on attitudes and practices of prosecutors and judges. Do you think that any of the variables you found as significantly related to population capture or are proxies for bail practices?
So I thought this was a really great question. And, to clarify, so there's really a couple different things we're talking about here. One is our survey, which we are doing and is still ongoing, and we gave you some preliminary results from. The others, for which we did the prediction of jail population and provider rate, is from these nationally available databases. And so I don't know, Faye or Niloofar, do you know if those variables in those national databases reflect bail practices or could at all?
Well, I mean, we didn't display this, but we did a series of analysis looking at factors that predicted the size of the pretrial jail populations. And essentially, we got the same results from that analysis as the analysis of the overall jail populations. And that's probably because, most jails, somewhere between, 50 to 70% are pretrial populations that go in and out. So I think that we can extrapolate from our analysis about the practices in that particular jurisdiction. What we are trying to learn is really what kind of services or diversion or deflection, if you want to use those particular terminologies, exist that jurisdictions can rely upon instead of the local jail. And we showed you some preliminary findings here, but this question that Mark Stern has raised, and hi Mark, is that, if any of the variables that would reflect a pretrial population, and I think the answer to that question, honestly, Mark, is essentially what we learned here is the size of what's available in the community, and whether or not there are service deserts or whether or not there are more opportunities for police or for, the general public to use services in the community could have an impact. But without those, we tend to see these larger populations in terms of the size of the jail. In terms of attitudes of prosecutors and judges, that's not part of our study, but we do have some questions in our survey instruments about collaboration with prosecutors and judges, treatment providers in the county. And those are some of the implementation practices that we really want to learn.
Yeah, and I would add to that. So we said we're sending the survey to multiple people in the county. Part of that is that we want to see whether the degree to which folks work together or see things the same or differently has anything to do with the outcomes, right? So we really are interested. We're interested in hearing from all the counties, but from multiple respondents in the counties, because ultimately some of this relates to how the degree to which people are on the same page or not.
Right.
Great. So this is not so much as much of a question as it is a comment. Someone said, I would love to have the data that was just shared. Thanks. One thing I will add is that our next webinar is specifically about these data sources and kind of how we use them. And it would be it's a great webinar for you to attend. So that way you can kind of figure out exactly where we pull this publicly available data from, where you can go and get it for yourselves as well. So a question.
Oh, sorry, Alex. I was just going to offer that it's Joe Ray. If Joe Ray wants to contact us, we're happy to share some of the data on your own jurisdiction. Similarly, Laura asked a question about whether or not 41 counties that she serves are participating in Arkansas. And Laura, if you don't mind, we'll be back in touch with you, because we do have every state in the United States is represented in our survey. And if we could elicit your support in trying to help get the counties to participate, that would be awesome.
Yeah, and it would be great. So people are sort of asking for the slides in the next webinar. If we can PDF our slides and send them to everyone who registered and along with the registration for the next webinars, I think that would answer a lot of folks' questions here.
Yep, happy. Well, that's a good idea. Thank you.
Yeah, we just send them out so that we don't have to keep track of everyone who asked us.
So Jill, I would highly recommend that you send your request to our general number. I'm going to jot it down, but I can't guarantee that it won't get lost in some piece of paper. So other questions, Alex?
Yep. So we have two more questions in the Q&A. The first one is, when you consider a jail population in a county, have you accounted for inmates that are not residents of the county's jurisdiction?
So the data that we used was from the Vera Institute in New York City that details jail size. And I don't know, I'd have to go look it up, but I'm pretty certain that does not have any indicator of how many people are residents of a county. In fact, that's a good planning question that might be useful for you to actually see in your own jurisdiction is, can you see how many people are in your jail that are residents of your county? Jails also have a very long history of renting out space to the federal government as well as to state prisons, in which case other people, are involved in your jail. And yes, we can get the recording as well as the slides to people. Another question?
Another question is, do you specifically reach out to public defender offices as part of the information gathering process? The perceptions are likely to be different from prosecutors and law enforcement personnel.
We would concur with that. At this point, we are not necessarily reaching out to prosecutors, any law enforcement or public defenders. We are curious though, and we have questions in our survey as to who's involved in some of the policy teams. So we would like you to tell us, have you included your public defender offices? How many people include prosecutors, law enforcement in some of their planning efforts?
And I would also say, you know, if you have somebody you think would be interesting for us to talk to, email their information to our address. And, you know, if they don't fit one of our criteria, we may just pick up the phone and have a conversation with them that would inform some things.
Yeah, I mean, we're hoping you don't mind if we keep in contact with you all who have registered for this webinar, because we learn so much from you in terms of your own experiences, and we are trying to capture that as part of our particular study. Alex, any other questions?
Yep, one more question was just added to the chat box. Given that this will be focusing on the adult population, will you all still consider giving the counties a list of data points to collect in the juvenile/school systems in their counties to better address the creation of a meaningful continuum?
We're happy to share with you, Sonia, our data sources, and also Alex was involved in another project that we've done at George Mason, looking at juvenile populations, and we can share with you some of those resources too. So just drop us an email, and we're happy to share what information we have. If there are no other questions, I know everyone's got a really busy schedule. I want to thank everyone for their participation today. I want to thank everyone for the awesome questions. We hope that this big brush overview can tell you not only about our study, but what we're learning about jail populations and the factors that affect the size of the jail populations, as well as the importance of trying to actually include information, about mental health capacity and the interface between justice and health, which we know those dynamics have been siloed for so many years. So I want to thank Niloofar and Jennifer and Alex and everyone on our team. I want to thank our partners at CSG, NACO, and APAF for this opportunity to do this work. I can say I'm learning things every day, and we look forward to hearing from all of you. Thank you, and feel free to contact us. We have the web address is actually in the chat box, but we'll send it out again. So thank you very much.